Welcome. My name is Sarah Clover, and I'm a speech therapist here at Levine Cancer Institute. Today we're going to be talking about mindful caregiving and helping loved ones with memory and other thinking issues. Today you're probably here if you're a loved one, a family member, a friend of someone here who's being treated for cancer or has had cancer in the past. My hope is that you'll walk away with a little bit more knowledge about speech therapy's role in part of cognitive rehab here and what you can be doing to help your loved one at home. I work in the head and neck cancer department primarily, but one day a week I'm up in supportive oncology helping with our cognitive rehab team. So I'm always here if you guys have questions or concerns. To start, we're going to go over 3 key words that I'll keep repeating over and over again in my presentation so that everyone has a firm understanding of what I'll be talking about. Oncology is the area of medicine that focuses on cancer. If you're watching this presentation, you're likely a caregiver. An oncology caregiver is somebody who helps a loved one, a friend, a family member, maybe even a paid caregiver who's helping someone who's going through their journey of cancer, be that treatment, being years after cancer. It can be anywhere along the spectrum. Caregivers are important to also target with this because usually it's a life-changing event for them as well. Cognition is the different processes our brain uses for thinking. So that can include attention, memory, problem solving. We use our brain for all kinds of different things every day. They can be small tasks like remembering how to make coffee. It can be bigger tasks like keeping your focus on my presentation for the whole 30 minutes, to planning your daily schedule. When am I going to get the laundry done? How do I time picking up my kids at the right time? The last word I wanted to make sure we understood was communication. Communication is our ability to share ideas, to understand what other people are saying to us. So that's talking and listening to other people. It can also be non-speaking ways of communicating, like gestures, writing, reading. A lot of times when I'm talking about this with patients, they might note I'm having a hard time finding the right word, or they're not following instructions completely. And so that will be where we'll delve into some more problems with those patients a little later on. I'll start by telling you a little bit more about me and my background. So my name is Sarah Clover again. I'm always around if you need me. I went to the University of North Carolina, Chapel Hill for undergrad. I was a journalism major, so words are very meaningful to me. I got my master's in speech language pathology at the University of Virginia, and I have been at Carolina's Medical Center now for almost 8 years. I spent my first 5 years working in acute care, where I started to really gain interest in the oncology population, and then I transitioned to working over here at LCI about 3 years ago, where I've been working with cognitive patients, so memory, attention, problem solving, as well as head and neck cancer patients and any swallowing or speech problems that they may have. To review our objectives and goals briefly, I'm here to help you as a caregiver better recognize the signs if your loved one might be having new deficits or concerns within cognition or communication. I want you to be able to recognize these changes and maybe even have an understanding of why these changes could be happening. I want you to be able to have practical strategies that you can be using to help your loved ones when these new concerns arise. And primarily, I want you to understand why your patient or your loved one might need to be seeing a speech therapist or another member from our supportive oncology team if they're having these new cognitive concerns arise. The overarching goals being for us to educate and empower caregivers of oncology patients to understand and better manage their cognitive and communication problems. I want to promote timely referral for you to see me or Kaylee, one of our other speech therapists, or one of the other neighboring Atrium facilities to provide individualized support for our patients here at Atrium. A common question I get when family members and patients come in are, why would I have these new cognitive and communication deficits? I don't have brain cancer. And it's a fair question. A lot of times we don't have one firm answer for why a patient is having changes to their memory, attention, or problem solving. But these are a few of the different realms for why it could be. Chemo and radiation are a very prominent reason for changes within our brain. The term chemo brain might be something you're familiar with. We'll delve a little bit more into it in the next slide. But either treatment can directly affect the brain cells and slow down our processing speed. Medication is another huge reason that you might notice some changes in your loved one's thought process. Pain meds, sleeping meds, anxiety medication, or really some combination of a bunch of different kinds of drugs can lead to a person having slower thought processes or having a harder time retaining information. Fatigue and emotional stress work similarly to medications. A lot of time having ongoing tiredness or a lot of anxiety, fear, can really slow down how our brain is working, and if it's making everything work slower, or if you're really having a hard time paying attention because you're focusing on, recurrence or how I'm going to pay the bills, that can also negatively impact how our brain is working. The final component I listed on here that most people have come to mind when they think about brain changes from cancer are because of cancer within the brain. So that can be brain tumors or brain metastases, meaning cancer moving into the brain. Treatment-related brain malfunctions could also be like a stroke or a seizure. So we're also looking at those patients when we're concerned about new cognitive changes. Within this slide, I didn't even list that there could be other medical complications like infections, low oxygen levels, or a patient not getting enough nutrition and in turn causing poor cognition. So what is chemo brain? The long and the short of it is we're not 100% sure. How it turns up in patients is trouble with thinking, trouble with memory, and maybe even having some communication errors that are caused due to cancer treatment. Chemo brain is a widely used term because this condition was first reported in people who had chemotherapy, but experts don't fully know the causes of these concentration memory changes. There's likely more than one cause, similar to the last slide that I just talked about with medication, anxiety, stress, and also cancer treatments. If you're concerned that your loved one might be experiencing these cognitive changes, such as chemo brain, it's important to encourage them to talk to a healthcare provider about these changes. Maybe it's their medical oncologist, maybe it's their primary care provider. If you yourself feel like the patient has lost self-awareness, they aren't safe at home, they have poor judgment of how much this is or isn't affecting their day-to-day life, I would encourage you to come with them to appointments to really advocate for the patient. We really just want them to be as safe as possible, and sometimes these changes can be very minute to very life-altering. Now we're going to get a little bit more into the signs you should be looking for in your loved one if you're a little concerned. The first topic that we'll cover is memory. So memory is our ability to store and recall information. So you might notice this in a lot of people, forgetting our keys once in a while, forgetting our wallet. I want you to be more concerned when you're noticing a gradual decline that seems to be getting worse and maybe the patient isn't able to compensate for. So this could look like forgetting to take their medicine, missing appointments, misplacing items frequently, forgetting how to use familiar devices like a coffee machine or their computer, getting lost in familiar places. For some of my higher level patients who could still be working, it could be losing track of bills or financial tasks. It could be forgetting names of familiar people, or even appearing confused or overwhelmed when trying to recall past events. Now we're going to move on to signs to look for when there's inattention or having a hard time with attention. Attention is our ability to focus on a task or conversation. You might notice yourself having some inattention if you're having a hard time watching all of my slides. Attention looks different for different tasks. Difficulty focusing on a conversation might look like someone asking you to repeat the same answer over and over again. Getting distracted easily might be constantly getting up to, start a task and not finishing it. Maybe you make a lunch, then you walk away and you come back and find that half of the sandwich is still there. Tuning someone out or zoning out during dinner with a family. The person is often staring off into space and needing you to verbally cue them or asking them, hey, are you paying attention to me? Tasks taking longer than before are another clear sign. And like I said before, jumping from task to task. It can look like someone who's having a hard time multitasking. Another area you might notice a loved one having a hard time in could be weaker problem solving. Problem solving is the ability to think through challenges, make decisions, and find solutions. We do this every single day. You make a goal, you think of the plan to achieve said goal, and then you review or revise how you did so that next time you can target it better, or so you can figure out what your next goal is going to be. Within our goal setting or problem solving, we also have to use processing. How long does it take our brain to take in the different steps, have a firmer understanding of the information we're given, and then come out with an output or next steps? If your loved one is having a hard time with this, you might notice they're always having a hard time setting concrete plans, organizing their life, poor judgment or decision making, so it can often be, in my lower functioning patients, a safety concern, or needing the same instructions repeated again and again. For example, if a patient gets their doctor's appointment moved, maybe they're not sure what the next step is going to be. Do I call the office? Do I wait for them to call me? Maybe I should just drive up to the hospital. It could also look like a person forgetting to do the things that they always used to do automatically, like leaving the stove unattended or giving their personal information to someone over the phone without thinking about the consequences. The final area for you to be aware of is communication breakdowns or difficulty for the patient communicating with you or other people. When we think about language, there's expressive language, which is when you're trying to communicate with other people. This can be through words, gestures, writing, and then the other side of communication is receptive language, so your ability to understand what other people are saying to you or what they might be writing to you. You might notice in a loved one that they're having a hard time coming up with certain words. I call this word finding deficits. It can be very obvious, like instead of saying microwave, they're saying refrigerator. You might notice that they're pausing a lot or having to think extra hard before they get a word out. You also might notice that they're misunderstanding other people a lot more. So you're saying one command and they're doing something opposite, or they're asking you to repeat something and seeming a little frustrated or overwhelmed during communication. So how can these problems impact daily life? I often have patients who say, I've always talked slow, I don't work anymore, I don't need to remember specific math equations, or I don't need to be perfect with my words. And that's completely true, but we definitely want patients to be seeking help if changes are interfering with their daily life. If they're feeling like their quality of life is poor because they can't go out and hang out with their friends anymore. If they can't remember how to play the piano like they used to love to. For some higher functioning patients, it might impact their ability to go back to work, to send emails, to run lists and plan events like they used to. It can lead to a loss of independence, like needing more caregiver support or having to move into a different living situation. For some of my patients, it prevents them from going out, like I was saying before, and spending time with their friends, or feeling uncomfortable if they need to be talking in front of a large group of people. A big indicator for you is caregiver stress, and by that I mean it can lead to a lot of caregiver burnout if you feel like the person that you're caring for isn't safe or is having a lot of anxiety or sadness because of these cognitive deficits. You're not alone. There's so much support available within supportive oncology, and I love to be one of those resources for you. So as soon as you start to notice any cognitive or communication changes impacting you and your loved ones' lives, we're here to help in whatever way we can. Another question I get often is, how do I ask for help? Who do I go to? I often encourage caregivers to go to their family member first and say, these are some changes I've been noticing. Have you been noticing them? I would love to talk to your healthcare provider about them with you. If you have concerns about their safety, the patient's judgment, and if you think that they are in an appropriate place to make that decision for themselves, I always encourage family members, caregivers, to go to appointments with the patient and maybe, ask appropriate questions or pull a provider to the side. I never want you to feel like you have to go behind the patient's back, but just keeping a real open and honest conversation with your loved ones. I have kind of like a little conversation for what it could look like for you. I always would encourage you to introduce yourself to the healthcare provider. So like, hi there, my name is X, Y, and Z. I've noticed some changes in the patient's thinking and memory recently. I wanted to double check and see if you think it could be because of their cancer or cancer-related symptoms. I would come with specific examples. Forgetting their medications, always late to appointments, doesn't seem to be following conversations anymore, is really withdrawn, very anxious compared to their baseline. You could go from there to asking the healthcare provider, do you think this could be related to their cancer or cancer care? What are the next best steps? It's completely okay to point blank ask for a speech therapy referral or a neuropsych referral, who we'll talk a little bit more later on today. Like I said before, make it an open conversation, talking to the patient about it so they don't feel like you're going behind your back. Speaking of neuropsychologists, what is a neuropsychologist? So we here at Atrium at Living Cancer Center, Maine, have 2 different neuropsychologists, and their roles are to work as specialists who study the brain and the effects of thinking, behavior, and emotions based on different neurological components, treatments, diagnoses. They do a very long, in-depth test to look at attention, memory, reasoning, language, a lot of the things we talked about today and more, including a psychological component or mood or emotion balance. They can help determine whether these changes are related to cancer, treatment, or other factors like anxiety and depression. Recommendations from them can be anything from looking for different living situations, driving or not driving, if the patient might benefit from having daily routines, if they need to start seeing a speech therapist, if they could benefit from physical therapy, occupational therapy, going to see a counselor. They're really a great resource for my patients and often work very closely for me and my cognitive patients, as well as with caregivers who have questions or concerns. So, what about a speech therapist? What is our role within cognitive rehab? It's a great question. I know a lot of people are familiar with speech therapists working in the school system, or maybe even working at your local hospital with swallowing. Within the cognitive realm, my big areas of interest are memory, attention, communication, and problem solving, a lot of the fields we've already been talking about today. When I meet a patient, I do a thorough chart review before they even walk in my door to know more about their medical history, treatments, and anything else that could cause changes in their brain function. From there, I do some standardized testings to look more in depth into all of the realms we talked about earlier. I like to have a very open conversation with my patient and caregivers. What changes have you noticed? How has that impacted your quality of life? Oh, you're talking fine, but you have noticed you can't watch TV shows for the full duration, or you're always getting lost when you're reading your books. We might even ask more vague questions, like asking how your confidence is, where you might be noticing if you're feeling more tired or not. After doing an interview with the patient and family, I try to come up with a personalized treatment plan for goals that are important to them. Instead of just doing repetition, which is a great way to work on memory, okay, what's something you haven't been remembering? It's your family's names? Okay, let's make a train of that and think about how we could associate different things to help you remember their names. I find that patients feel more motivated when we're giving them functional therapy that works towards a goal that's personal to them, and then they can apply that to other realms of their life. I also help with compensatory strategies. For example, if a patient is having memory issues and can't remember what they need to buy when they go grocery shopping, okay, what works for that patient? Every patient's going to look different. Maybe they need a written list. Maybe they need to come up with a way to rhyme the words that they need in their head. Or maybe they need to use their phone because they're more tech savvy. Even though I'm primarily working with the patient, I really encourage caregivers, family members, to be at the appointments so that they can carry over those strategies, over those new training systems for the patient to use them at home appropriately. So what are some of those strategies that I use with my patients? We'll start with some of my patients who might be having memory deficits. Again, I want to emphasize strategies work best when a patient is seen by a speech therapist who can give them professional advice and help them pick strategies that work best for their lifestyle. But if at home you're starting to notice your patient is having some memory issues, I would encourage use of notebooks, writing things down, using your notes app in your phone. You can also really help a patient by helping them get on a daily routine, getting up at the same time of day, taking their medicine at the same time of day, maybe even setting alarms to help them get acquainted with the different times of day they should be doing things. As we build a habit, it's easier to keep that habit without thinking about it too hard. Another great thing to be using is our calendar. I use my calendar for every single appointment or else I would forget it. And I think a lot of other people function under the same criteria, and if they haven't, maybe now that these patients are going through cancer treatment, are feeling a little bit more stressed, they need to rely more on a calendar or different notes to help them remember things. The last thing I've written here is repetition. Repetition is probably how you as a child learned your multiplication tables. It might be how you learned to spell certain words. Repetition is a great short-term memory fix. You need to remember to grab your shoes when you go upstairs. Shoes, shoes, shoes. I'll say it 13 times in my head all the way until I get to the stairs, see my shoes, and take them upstairs. What about strategies for attention and problem solving? There's usually a lot of overlap here. I would say one of the biggest things is to minimize distractions. Distractions can be anything. It can be a radio player playing too loud, TikTok on someone's phone going off all the time. It can be internal distractions like negative thoughts. In that case, I encourage family members to think of ways to limit those distractions. Okay, while we're eating, let's turn off the TV and really focus on what a great meal we had. If they're having a hard time thinking about steps, let's really simplify it. All right, I'm going to make the coffee. Let's think about all the things that we need in advance before we start the process. The first step is putting it into the container, pressing start, different machines, different thoughts. Maybe writing it down so the patient has a checklist to give them extra visual input when they're starting a new task. My final strategies are for communication. A lot of times it can be frustrating and hard to watch a loved one having a hard time to communicate. People often want to really help them by speaking slower or speaking louder. Speaking slower is great, but keep in mind they're still your adult loved one and they want to be treated like an adult. So speak slowly. Maybe simplify steps. Not running all of your words together and going as fast as you can. Asking them if they need anything to be repeated. You might even just have an open conversation with them and say, look, I know you've been having a hard time understanding or getting your words out. How can I best help you? Instead of talking for them, giving them options. I see that we're talking about coffee. Were you telling me you wanted another cup or you were having a hard time doing something? Avoid correcting or interrupting a patient. It can often lead to feelings of sadness or anxiety. Instead, give them plenty of time to get their words out and wait until they ask for help. Another realm that can be really helpful is using gestures or written cues. That way the patient's getting different kinds of input from you to help them better communicate their wants or needs. All right, and we're at our takeaways now. Cognitive communication changes are common after cancer treatment. It's nothing for your patient to be bashful or intimidated to come to a provider with. If they are having a hard time, I encourage you as their caregiver to help them talk to a healthcare provider and encourage them to get the help they need. Strategies can work. I give them to my patients every single day, and it can really improve their quality of life and help them to feel like they're not so alone. A speech therapist like myself or another speech therapist within your community is super helpful to pick out these strategies and to better understand the patient's deficits. As you can tell with my presentation today, Sometimes an attention problem can look like a memory problem, can look like a problem-solving issue. So bring them into a professional so we can help you guys better understand where the breakdown is and what we can do to help them in the long run. Like I said, speech therapy is a great starting point, but neuropsychologists are another great resource that we have here at Atrium, and I would love for us to be able to utilize for you and your family member. The last takeaway is that caregivers are key partners in recovery. A lot of the strategies I gave you today don't work if you don't have someone else who has buy-in. Okay, your family member does better if she has written list. Write them a list when you need them to get certain things done. Your family member does better when they have extra time to talk. Giving them that extra time, not interrupting them, and letting them know that you're taking their needs as seriously as they would take yours. Thank you guys for coming and joining my talk, and thank you so much for being caregivers. As a member of our caregiver support team here, I've really enjoyed getting to help our caregivers and celebrate all you do. Remember, a caregiver can be a wife, it can be a friend, it can be a cousin, anyone who's supporting our patients as they go through cancer treatment and beyond. If you have any questions, feel free to email me at sarah.clover@advocatehealth.org. I'm happy to help in whatever way I can. Have a great day.
Thanks for watching. For more information, visit us online, send us an email, or give us a call. Don't forget to click subscribe and hit that notification bell so you know when new videos are released. And most of all, be well.